Hello and welcome to the 22nd episode of the Nonstop Podcast with Pooja. With me, I have a very wonderful human being, Nadja. Nadja is from Brazil and she's a doctor by profession, but there's so much more to her, and that's why I have her with me today. So thank you for coming on the podcast, Nadja.
Thank you very much for inviting me. It's a pleasure, really, especially because of the reason of this podcast.
So, let's introduce you to the podcast, right? I cannot fathom to tell all that you are in one sentence. So let's start off with your name. So your name is Brazilian or is it Lithuanian?
Neither. It's Nadja. It's or a Russian derivation or adaptation from another Russian word called Nadezhda. I don't speak Russian, so I am sorry for my pronunciation. And it means like hope. But it's also like an Arabic name, which is many Arabic people also can pronounce my name like Nadja. And Nadja in Brazil is the way that people try to speak my name, because it's like Nadja, and it is not very common. It's very common in Brazil. Not very common, but a little bit more, like Nadia, so Nadja. But yeah, so Nadja in Portuguese or Nadia here in Lithuania.
Okay, great. So you have a very interesting background. You reverse immigrated from Brazil to Lithuania once you found out that you have Lithuanian roots. By profession, you are a doctor. You've had education backgrounds in Germany, and you thought of having some in England. So how did this come about? A, about why did you want to reverse immigrate? And B, why did you want to be a doctor?
When I was a child, I used to listen to my granddad's and my granddad's sisters' stories about their lives here in Lithuania. So they immigrated to Brazil from Lithuania in 1927, so after the First World War. So I always had contact with the Lithuanian culture in Brazil, and São Paulo has a big Lithuanian community. But I only had contact with this community when I was 15. So, and then at that time, after it, I had contact with the community in São Paulo. But before that, when I was 15, I decided to come to visit Lithuania. And this was in 1995. 1995 was just after the independence, I can say that, from the Soviet Union. So Lithuania was totally different from what you see now, 30 years ago. But even so, I love it. And I just wanted to come here and to live here. But of course, at that time it was very difficult to fly and to live here in Lithuania. So I went back to Brazil and continued my life there. I also always want to be, since I was a child, I want to be a doctor. And I like to look after people. I liked it, it was a pleasure for me to look after, especially my granddad, my grandma, so the elderly. And then I always wanted to be a doctor. I don't know, that was like inside.
Okay, that's wonderful. So I think I can understand why you wanted to reverse immigrate, because, there was something in you that intrigued that there is a culture that you want to be a part of, but you're very much a Brazilian as well. Mm-hmm. You were born and raised in Brazil, mm-hmm. and I'm sure the idea of you wanting to be a doctor would have come to you because something must have inspired you. Is it something that happened in Brazil, or is it the circumstances that was in Brazil that, intrigued you to be a doctor? And why did you choose to study in Germany?
I not sure why I wanted to be a doctor. I had only contact with doctor because of my mother's cousin, but he was like a brother for her, and he was a neonatologist. So he was a pediatrician, but specialized in newborns, newborn babies. And I had also, he was from my mom's side and also like the Lithuanian side of the family. So I was very close to him. And maybe because of that, I want to be a doctor, but I never want to be a pediatrician. Don't know, ask me why. But but to go to Germany, it took a long way still. I first finished my medical school in Brazil, so I studied there 6 years, and then I moved to England. So in England, I started my residency. So it's a different name for the medical system, residency system in England. And so it's foundation year 1, foundation year 2, the foundation training. Then you go to core surgical training 1, core surgical training 2, because I always want to be also a surgeon. Just during my during my medical school, and at the last years, I wanted to be a urologist or a plastic surgeon, because in Brazil it's very popular in plastic surgery, and it's very nice because it's very like broad. You can do not only aesthetics, but you can do like for burns, like for other types of, and that's what I wanted to do, like the more medical side of the plastic surgery. Mainly because Brazil is a very sexist country still, unfortunately. So like for a woman to be a urologist at that time, it was like maybe 1% of all urologists in Brazil was women urologists. So, but I was, wanted to come to Europe. I wanted to live in Lithuania, but then life sent me to England first, because I could speak English better, and the job opportunity in England was higher and easier to get a job there. So then I started there, then I finished this 4 years there, stayed another year. Then I moved to Germany, because in Germany the residency system is like here and like in Brazil. So you go from medical school directly to the residency. Then you study like 4 or 5 years. So then I studied in Germany, just urology. Because in England you study everything for this 4 years, and then you go like core surgical training is 2 years of core surgical training is more specific to surgery, but then you go to other specialties and you have a lot of practice with general surgery. And then I said, oh, I don't want to be a general surgeon, I want to be a urologist. So I moved to Germany because I also could speak a little bit of German, and Germany has a lot of still opportunities for doctors. So I moved there. I don't know why I moved there instead of moving to Lithuania. That's a good question. But then after finishing that, then I decided to finally come here and live here, I hope, forever.
Wow, that's so nice when you know for certain where you want to be and what you want to do. So you said you are a urologist, right?
Yeah.
So what really is urology? Because, I mean, I can understand from the very word of it, what could be synonymous to it. What is urology and what are you doing right now? Because I know that you're not doing anything related to urology.
I am.
Oh, okay. Okay.
Well, urology is the specialty that look after the kidneys, the bladder, the male parts, then prostate and testicles and urethra. So, and then we have the oncology part. We have the children urology, and so it's very, very broad as well, specialty. But I here in Lithuania, I do work in the polyclinic, and the polyclinic I don't operate there anymore. So I do just like consultations and ultrasound, kidney ultrasound, bladder ultrasound. So we treat the oncology, like cancers in the kidneys or in the bladder or in the ureter, which is the tube that connects the kidney to the bladder. cancers from also in the urethra, prostate cancer, and other male parts cancers. And we have the other part, which is then not oncology, but then is incontinence, urinary tract infections, and you have kidney stones, bladder stones, and then you have other infections, like we call epididymitis, which is infection in the testicles. So you see a lot of things, and incontinence, impotence, and all this, fertility as well.
So I am sure that we also want to hear about, you also do acupuncture.
Oh yeah, I forgot to talk about it. Yeah.
So how did that, kind of shift happen to acupuncture from urology, or while practicing urology, doing acupuncture?
Yeah. Well, as a doctor, I cannot get out, completely from this part of the traditional or not traditional medicine, the Western medicine. And acupuncture is very popular in Brazil. So, I think 90% of people in Brazil have already had contact with acupuncture, or at least know what it is, which is not like here. It's the opposite, maybe here 10%. But, and I think since I was a child, I had acupuncture treatment. So for me, it was like normal. Acupuncture is, everybody knows what acupuncture is, But I never thought of working with it. When I got a very bad ear infection when I was still in Germany, but in the transition from Germany to Lithuania, I had already decided to live in Lithuania. I had a very bad ear infection and I needed to operate, and I was taking like a lot of medication for the pain, antibiotics, probiotics, and for the stomach, to sleep, to help keep me awake, and like vitamins, and I was thinking, like, my God, I'm, like not even 40 at the time. And it was like 30 tablets, like 10 tablets 3 times per day. And I was like, no, that's not normal, like I'm healthy. I never had to take so much, medication and pills in my life. But then, like I was thinking about my patients, and I was like, no, it must be another way, because, like the elderly people that I see in the hospital, they take like 30 every day, and for maybe, like 20 years, and it should be another way. And then I think that was an angel that came to my ear and said that, like, contact this person about acupuncture. And I was like, acupuncture, okay, why acupuncture, like it's something like not very obvious, but I was like, oh, maybe acupuncture. And I was like, okay, let me talk to Paul Watson. It's a colleague from England. I hadn't had contact with him like for 10 years. And I knew that he had done acupuncture. He's an anesthesiologist in England. And at that time, he was in the first year with me there, and I was like 10 years. And okay, Paul, hi, I remember that you had you've done acupuncture. What, can we talk about it? And he immediately answered me, yeah, okay, I'm free now. Do you want to talk? And I was like, yeah. And then we started talking, and then he showed me about Western medical acupuncture. And there's a Western Medical Acupuncture Society, which is acupuncture for doctors. And then I started, reading about it. And then I went to those courses in England and ear acupuncture courses. And then I started here practicing, because I was already living here. And then I started practicing with friends, and they were like, oh, that's very good. Oh, my nose, like it's not blocked anymore. My allergy is gone. I feel much better, and the neighbors as well, because I had to practice, like, who wants acupuncture? And then everybody was like, feeling very happy. And I was like, maybe I can work with that, And then I started working,
Wow, it's actually very fascinating, because I come from the global south, from India, and these practices are much more vital. In the West, everybody wants, quick fixes sometimes. I wouldn't say it's a larger ideology, but I would just say that the ambition of medicine is much more advanced in terms of technology, in terms of research, especially there's a lot of research institutes in England and in America. And vis-a-vis, they are trying to bring up new technologies to cure diseases and infections, etc. But in the South, you would see that there's a lot more natural remedies to it. And in a country like India, where, we kind of believe the natural way of life is more, I would even say the beauty standard still today is more, how natural you are, the more beautiful you are, right? Mm-hmm. Whereas in other parts of the world, the beauty standards even vary. So I could see things like Ayurvedic medicine, acupuncture, far more believed and far more practiced. And in China, for example, acupuncture is very popular as well, and many ways of medicine. What would you say is the biggest benefit from acupuncture? Is it just for temporary release, or do you think that you need it along with Western medicine or medicine in general?
Yeah, because I practice Western medical acupuncture, so I don't follow the main philosophy of Chinese medicine and the acupuncture that is practiced mainly in the Western, in the East countries, like in China. But we have this different technique with Western medical acupuncture. So we go quickly because we want also the quick results. And so then, if you come with already a diagnosis like migraine, for example, if I want to compare one and the other, so the Chinese traditional Chinese acupuncture will diagnose you according to the 5 elements or according to many other, patterns of your problems. So like the tongue diagnosis or the pulse. They will check the pulse. And then because Western we see like migraine is headache, and then there's a lot of course a lot of cause for it. But then, for example, like a simple one, tension headache, and then we do have specific points for it that help. So then we explain to the patient that we may help that on that day and on the next day, but we need to continue the treatment because I compare it to antibiotics. I never say that the patient has to withdraw any treatment. We always go with acupuncture alongside the Western treatment, the allopathic. So if you have to take antibiotic, you take antibiotic. If you have to take blood pressure tablets, so you take them, and chemotherapy and everything else you do according to what your doctor has prescribed. And acupuncture will help you in a general way because it will reduce the pain. It will help you to improve your sleep because still acupuncture is not only local effect, but it has central effects. So when you stimulate the point in your hand, it will have an effect on the whole body, for example, and it will help you sleep and it will help to have balance in the body. So it's a very alternative, but it's more complementative therapy. So it will help, yes, reduce the pain. It will reduce the pain straight away, sometimes and even for a longer time. But you still need to continue with the treatment, the allopathic treatment, and with acupuncture for at least a few weeks, and then after that, just top-ups, for example.
Okay, that sounds more like a physiotherapy, rehabilitation process. Good. I'm just curious. I do not know anything about acupuncture. So can you tell me where the origin of acupuncture is from? And if I have to come to you, for example, we go to doctor and very specialized doctors for very specific purposes, right? If I have a fever, I can't go into a gynecologist clinic, even though very much I know that they can treat me. Yeah. So in acupuncture, if someone is to come to you, is there a set of diagnosis, or how do you assess them? Do you ask their past medical history, or what is the way of, because in my head acupuncture sounds like feng shui, like something to do with, like, I don't know, astronomy, but yeah, I will let you speak on what acupuncture is.
Nowadays we have many research, medical in big medical journals like the Journal of the American Medical Association. Cancer research also has many conferences, also big conferences like ASCO. We already have a lot of acupuncture research proving that acupuncture can help physiologically, and when we stimulate some points, because what happens when you put the needle in one point is like a micro trauma, and when there is some trauma in our body, we can heal by ourselves. How many times you cut your finger and you didn't do anything, but it regenerates. So when you have this the same process happening, at that place where the needle was put, but because it's like net of communication inside our body, so we have specific points that were already studied and proven that if you put the point in the leg, and then it will show some effects in the brain, because they did some functional magnetic resonance pictures and showing that it has an effect. And also they took some bloods and they proved that there is more cells in that area that shows an effect that will heal that area. So but because our body is very smart, it will have an effect also in the hormones. So you have the hormones in the whole body, the hormones levels, and it will stimulate our brain to produce and to release the happy hormones, so dopamine, endorphin, serotonin, oxytocin in the circulation, in the blood circulation. So people will find anyway a very good relaxation during and after the acupuncture. But when the patients come to me, so I always have my list of questions, like my questionnaire, and I go according to my medical background, my medical side of the Western medical acupuncture. So I always ask all the questions of which medications they take, family history, if there's any heart problems, neurological problems, sleep problems, then stomach, the urinary, the gynecological part, everything. And then, and then I write everything down, and the patients also, then they come already with the problem. So you come, I won't treat you with fever. So if you have a fever, then you have to, wait, take some medication, if it's not high, then you just wait. You don't have to take any medication, just plenty of fluids and rest. But if you come to me, for example, now there's a lot of good also research with acupuncture for fertility issues. So if you have fertility issues, then you come to me with already this diagnosis, and then, okay, but what else you have? Do you have then heart problems or diabetes or a lot of stress and, like the polycystic ovaries or, and then, okay, let's work with that main area, which is the why you came to me. But then we go and see, okay, I have headaches, and so then we have to treat the headaches prophylactically. So as a prophylactic treatment, I also put some points that will help for the headaches and for the gynecological issues. So then it's a combination always.
Wow, it's very fascinating for me. It's actually fascinating that you touched upon fertility quite a bit. And of course, this podcast, we have incredible women, and hopefully some women are listening to it. And fertility is such a unique topic in today's time, right? Because women are educated in today's time. Women want more. Thanks to our ancestors, they have fought it out for us. It's no more fashionable to sit at home, to just have children and raise them. Women are juggling much more responsibilities. And on that level, I also see there is a lot of step back in having children at the window, at the specific most, sustainable window, right? And people often delay the time that they want to get pregnant, want to become parents. And this often puts a lot of stress in themselves as well. And I'm sure you are also treating patients in terms of fertility and urological issues, endometriosis maybe, cysts and other criteria. And then I think you can complement it with acupuncture treatment as well.
Yeah.
So what is the most common young women I'm saying about the window? Because before 25, I don't think any girls or women are thinking about family these days. So what's the most common fertility issues that you see in women, and why do you think it's coming about, and how do you think we can reduce it? Is it just diet or is it lifestyle?
Yeah, of course that we have our natural biological cycle, that's all proven, but it's not anymore just older women that are having problems with fertility. It's funny because I wasn't planning to talk about it, but so it does come. Many patients come to me because some fertility doctors they know me and they have good results with acupuncture. So then we do like a combination. But the problem. There are many unknown causes, which could be hormone, plastic, products that we use in our body, and what the things that we eat, diet, lifestyle. So everything together. As a child, we eat too much, for example, meat, and then there's a lot of hormone in this meat, like all processed foods as well. So we know a lot about it already, but it's hard to change. And when we start changing, there has been already some damage to our cells. So there are younger women, 25 year old women that come to me because of fertility issues. Well, of course, that when we know the cause of endometriosis, then you have to operate, and then you can after get pregnant. But also like what we do with acupuncture is to help regulate the hormones, to help reduce the stress, because it's a lot of burden, and because the woman has to do all the tests, and then after doing the test, then it's not just the women, it's the male part as well, and so 50%, 50-50, and then they have to, get treated as well. So most men don't go and search for treatment, and from the couples that I see, if I have maybe 90% are the women that come to me, even if the problem is with the male part, with the spermatozoids or everything, maybe 10% of the men that came to me for the acupuncture treatment. But it's changing now, so like more women are getting more information, and then it's very, very effective because it helps mainly to reduce this stress. And we talk a lot. I talk a lot with all my patients because there's a lot of psychological issues around, because it's pressure from the society, pressure from the family, pressure from the husband, pressure from themselves. They do pressure themselves, and every time that it doesn't work is kind of like even heavier, this path. So acupuncture does help with this, to reduce this stress, this anxiety, to help sleep, to help the hormones, to help the circulation, to help before and after the embryo procedures as well. So to help with during the procedure. So it's only plus.
Wow, it's very fascinating for me that such a procedure can complement something that's quite uncertain, especially with endometriosis or any other fertility issues, especially in women. I know it's a research in progress. We do not have set in stone results, because every female body is different,
Yeah.
and everyone goes through very different walk of lives, and even like societal changes, climate, everything, diet, everything plays such a huge part. So I just wanted to ask this very interesting question because, in the Ayurvedic medicine of life, they often propagate that we eat fresh food, which also can mean more vegetarian food because it's easier on the body, it's easier to digest. And I mean, what's your thought process on these things, especially when someone gets acupuncture? What is the maintenance that they have to do so that they don't keep coming back to you with the same set of problems, right? Because you're ultimately pricking small needles into their nervous system to enunciate something that they are trying to suppress. Yeah. I assume that's what acupuncture is.
yeah, we can say that. Yeah.
So, what are your thoughts?
Yeah, well, we have to work with psychology as well. No? So I always talk to them, and some say like, "Oh, here's like psychotherapy." I'm not psychotherapist. I just according to my experience, life experience, patient's experience, and then I talk to them because. We have similar problems, but we react different to them, and we have different points of view. We are not the same, and we react the same to different situations, and our body reacts also differently. So I explain, but it needs to be not only from me. The patient has to do their part of the job as well. So they have to do their homework, and then they have to try to reduce processed foods, to reduce meat. I am now a vegetarian, but I wasn't, but now I am, and mainly because of the animals. But also because then after that you feel much lighter, healthier, and there's many benefits of the vegetarian kind of like food, and we know that from the nature comes everything, and we are nature basically. So when we know that our body can receive all the proteins and vitamins from nature, and not heavy and things that we know that can cause cancer. So like, why do we continue to take it? Why do we continue to smoke if we know that that's very bad for our health? Even this electric cigarettes is even worse. So like, why do we take so much sugar? Why do we drink so much alcohol? Everything in moderation is good, but also we know that some things that even in moderation is not good. So why do we continue to take it? So then we have to start this psychological part of the consultation and of the procedure, acupuncture, the points there in the needle. But then also when we have this in the body, this balance, so we won't need to crave for sugar. We won't need to crave for salt. So then the patients start seeing differently as well, and then they start taking more habits, healthy habits into their lives.
That's very fascinating. Towards the end of it, I also want to pick your thoughts on, is there any medical theory that has stuck to you personally, as maybe Nadja, who went into medical studies at 18, now several years and decades later, you're still in the practice, right? So every day, I'm sure you tell yourself something more than the validation of, giving something back to your patients.
Yeah.
What's the one medical theory that has stuck to you, or that's even in the recent past, or from your younger times practicing?
I think, the basic, do no harm. You try to avoid doing anything that is going to cause the patient harm, and talk to them about their habits, of harming themselves. So it can be with, with the foods, with the habits of, smoking or not doing exercises, or but also psychologically and spirituality. I always talk to them about spirituality, and I think it's important because it's kind of like you have to look after your body, physical body, your mental health, and your spiritual side. we are all connected somehow with something, doesn't matter if it's Buddha, Jesus, or just like an energy source. But I think we have this, and if we can have everything, in balance, and then it's important. And I always talk to them about it, and I listen. I think that's the thing. Not 100% of the time, because time pressure us at work, but that the thing that I learned with time is like to look in the eyes of the patient and talk to them, but mainly to listen to their complaints, because sometimes they say something, but the real problem is totally different. So
yeah, and in your practice time, was there any specific case that you're very personally very proud of? I'm sure every day is such a case, but any complex case that you had dealt with, or a situation in a patient, of course, what would you say that?
It's very hard, because I do take my patients like very, close to me, very personally. So I go through, their path together. So yeah, of course, that when patient cannot have, babies, and then they come to me like, oh, I'm pregnant, don't tell anyone yet, but let's find, and then I was like, oh yeah. But also, I think this one is the most, common, but now it's also getting, here in Lithuania, but because everywhere else it's more popular, here in Lithuania it's getting more popular with oncology acupuncture. So I want to go more to this area, because, there's a lack of specialists here for acupuncture with oncology patients. And then when they have, like they say, like, I have my life back, I can sleep. It's so, like.
What is oncology for people who don't know oncology?
Oncology, I'm sorry, this is cancer, cancer patients. So patients who have cancer and they have this, nausea, pain, burning sensation in their hands, or because of the chemotherapy, radiotherapy, and, because of the cancer itself. So then you have the acupuncture to try to reduce this, the reaction of the medication. So when they say like, oh, I could, couldn't even, get out of bed, and then when they, or vomiting all the time, or, and then you do acupuncture, and then they feel relief, and then they can, have their lives back, and that's, that's what's is most, that I am proud of it, because I work with acupuncture. So like, I'm just the way in the middle, like I'm the medium, the acupuncture and the patient,
Okay, let's go to a final question before I ask you the final question. What would you say in simple words acupuncture does, if you have to put it in a sentence? And why should a normal human seek out for it, irrespective whether they have ailments or not?
I think acupuncture can help you to find balance in life, in your physical body and in your everyday life. And I think everybody should have acupuncture, yeah. But not everybody can have acupuncture. There are some contraindications. So patients who have bleeding disorders, then you have to be more cautious. So then there's no absolute, there are some absolute contraindications, but then like some points that you cannot use, and some patients, they cannot lay still and relax. So some people, they are looking to the ceiling and say like every 5 minutes, is it done yet? How long do I take? How long does it take it still? Like, when are you gonna do it? Like, just relax. Relax, and with music playing and then warm and everything's fine, but the brain cannot relax. So like, some patients cannot have it. Some patients, they are not, okay, no, acupuncture is not for me, I don't like needles. It doesn't hurt. Acupuncture doesn't hurt. So you have a special, very fine needles, like our hair, fine needles. So special points that are, like painless. So like, everybody should even at least try a course of acupuncture, just not once, but a course of 3-4 times of acupuncture, and then they will see the benefits in their life.
Okay, thank you very much. That was a wonderful section of knowing to get to know Nadja and getting to know all the relevant work that you're doing.
Thank you.
But this is my favorite part of the podcast. I always ask the guests before I let them go. We've had a very snowy day here. What is your favorite book and what is the movie that changed your life? You can take this question as serious or less serious as you wish, but I look forward to hearing.
Well, I had many books that I loved, but I can say that the one that is very touching for all ages is The Small Prince. I think Saint-Exupéry. I don't speak French, sorry, but not yet, I'm learning. But then, this is the book for children, for teenagers, for elderly, for, and at all time you can read and reread it. And film, it's also hard, no? I love The Notebook, but because I'm a romantic person. And I have a similar story of the book, but with a different end. And it's a book and it's a film, no? But the Notebook, I think I saw this movie maybe 20, 30 times, I don't know.
I know that there is, there's a theatrical also that's coming.
Oh.
So maybe you'll enjoy going and seeing it in the drama theater.
Yes, nice.
But thank you very much, Nadja.
Thank you.
It's been an absolute pleasure, honor, and you are so lovely in person. Thank you. Thank you so much for accepting the invite and coming, and the best
it's an honor
wishes
for
to
me,
you.
and good luck with your project, and I'm always here for charity and for anything that you need. If you need anything here in Vilnius also, you can, or in Lithuania, you can ask me. And thank you very much for inviting.
Thank you.
It's my pleasure.
Thank you.